I was out here alone. I called the police trying to get help. I mean, I walked to somebody's house that didn't even know me, and he was scared himself, but he let me use his phone. The only thing I had with me was a small bag of clothes, and that was it. I didn't have an ID or anything on me.
Some of them are coming in with with barely the clothes on their back. You know, they might have just a couple outfits. They don't have proper clothing. They don't have anything to set up a house with if they did get housing. They have nothing. They have no money. They have no income.
They're in need of identity assistance. They're in need of mental health counseling. They're in need of clothing. They're in need of food. They're in need of life skill training. Perhaps many times they're in need of communication abilities with their families from wherever they may have come from.
They need to rebuild their entire lives in many ways. It's not simply about therapy to talk about what happened. It's finding them housing, finding them some source of income, rebuilding an entire social network for them to be a part of.
When I first came to Albuquerque and called the police, at that moment, I was really scared and frightened. I didn't know what was going to happen. I thought the guy was going to come home and see that I was trying to call the police. But they got there just in time, and they got me out of there and brought me straight to Santa Fe that same day. And that same day, that's when I met my caseworker and did all my paperwork. And that's when they just set me up with my therapist and set me up with my apartment.
Human trafficking is the exploitation of a person either through commercial sex or labor. Sometimes victims may be from overseas, from another country, or they may be our own citizens that are victimized here and exploited for labor or commercial sex. No movement is required. Across national borders is not required. Transportation isn't required. What we're looking for is exploitation taking place rather than movement. What we're seeing around the country and in New Mexico are most of these victims. Labor trafficking victims are foreign nationals. Labor trafficking victims can include persons working in the construction field, migrant farm workers, hotel lodging industry, restaurants. Any of these areas we might encounter labor trafficking victims or domestic servitude. Domestic servitude can include nannies, housekeepers, anybody working in the home.
The people that are trafficked aren't necessarily picked up in their home country and brought against their will. They're offered a job. Hey, I've got a great idea for you. You can be a maid, you can be a nanny, you can make all this money and send home. Once they get here, then they're put into the slavery, as it were, with human trafficking. And as such, that person has their passport. You owe me $5,000 for bringing you here. You owe me for your food. You owe me for your shelter. It's a debt they can never get out of.
Sex trafficking, we have in there kind of a subset. We have the minors and we have the adults.
Very often there's a bond between the victim and the person who is using them, trafficking them. The term often used as pimping them, to use them for their body in the sex trafficking area. Somehow there's a bond there. Also, there can be fear.
Just because a victim loves the pimp or is in love with them does not indicate this person is there willingly. A lot of times these pimps use this type of psychological coercion to keep a woman in the situation, sometimes maybe through drugs, beatings, similar to the domestic violence cycle we're familiar with. Many times these women are held through force, fraud, or coercion and don't feel that they are able to leave for many reasons.
When I first got out here to Albuquerque, I had never been to the West at all. I had no idea where I was.
Many times victims are brought into New Mexico or into any other country or any other state not knowing where they are. This is a ploy used by traffickers to inhibit victims from going forward to finding resources in their community.
Oftentimes it's the very simple things, like seeing people in the exact same clothes over and over again. They may not have ID, they may not know how to use a bank card, they may not ever have money with them. Foreign nationals, in my experience, they're going to be more the group situations as opposed to the individual situations. If it's a sex trafficking sort of situation with U.S. citizens, there may not be as big a group there are more individuals, one and twos.
You want to look for a person that is probably not alone, is closely watched by somebody else. The person feels like they have little freedom of movement to leave where they're going. A person who may feel fearful and no eye contact. And upon further questioning, you would determine and try to elicit if this person is free to come and go from their workplace, is living in a separate place from their workplace. Personal possessions are another indicator. If a person does not have any personal possessions, and if they, say, are here from another country, if someone is holding their documents, those are indicators that somebody has control over this person. Many times, human trafficking victims are held without sufficient food, nourishment, health care. So many times they may be malnourished, they may be suffering injuries, they may be suffering poor hygiene, poor dental care, any of these things where they may be held in a place where they aren't cared for. Branding is a form of ownership, and we can say that we know of branding as we do cattle, or back into early days of Romans where that was a sign of ownership. Today it's still used, and it's maybe more of a decorative way through a tattoo or so forth, and it can be a gang affiliation, and many times women used in the gangs will be branded and considered ownership of the gang. Labor trafficking victims may be held through debt bondage, may be living and working in the same place. Are they free to leave? Are they able to have relationships outside of the workplace? Do they come and go as they please, allowed to attend church? Any of these things are indicators, can this person freely leave? And if they're paid, what are they paid? And are they doing the work they were promised they would be doing once they were possibly enticed to come from another country or from another job, or are they doing different work? How many hours a day are they working? Sometimes some of these persons are working 14 to 16 hours days with only one break. So these are all what kind of living conditions do they live in? Are there 6 people to a 1-bedroom apartment? Any of these kind of indicators to show what their standards are for their home environment as well as their work environment.
To me, safety was really important because it's just like really hard, and you're walking around places, you don't have any transportation, so you think anybody could just come up to you and just snatch you up, and you don't trust people. You can go into like public places like I did and be scared and totally frightened of everybody there. You didn't want to, just want to stay to yourself, and like getting a caseworker and somebody that actually knows where you're coming from helps a lot, because you're not alone anymore. And then you find out that there's other people out here just like you, so you're not scared, and you can go to meetings to get help and be in the same place with other people that's been through the same thing you've been through.
I've done this work for many, many years and have seen all varieties of mental illness and trauma and other challenges that these folks are dealing with. This is a higher level in our experience so far. The old models that we've used, the traditional models of psychotherapy that may have been effective, may not be effective with these folks.
Even when I started going through LifeLink and trying to get help, I still didn't know anybody, so it was like I couldn't call anybody. I didn't have a phone. I was alone, didn't have any family out here. Basically just trying to make it on my own without anything, but it's hard. It's really hard.
The level of care, first of all, that they need is 24/7, round-the-clock access. It doesn't necessarily mean that you have to be with them 24/7, but they need to know that they can contact you, especially initially, anytime. So that's very important. That helps establish the trust also, and also imparts that feeling of safety. Okay, somebody else knows my situation, somebody else knows that I'm alone, somebody else knows that I'm vulnerable and I need help, and I need somebody to know that. And so I think it's really intensive case management, as opposed to just, at 5 o'clock, I'll see you tomorrow at 9 o'clock in the morning or something,
Well, the establishment of trust with this population is the most critical component. Nothing else is going to happen unless they're able to trust that you're able to work with them and help them out. They have been so wounded, so harmed by people who asked for their trust in the past, that it just takes that much more to really get them on board with what you're trying to do. And even ongoing, it's you know, you've worked with them for a long period of time, and suddenly, you know, one mistake that you make or one interpretation of a failure on your part, and you're almost back to square one.
You can't trust many people because the person you thought you trusted ended up making you do something you never wanted to do, so it's hard.
I think when you're talking with one of these victims, when they're first coming into your clinic, you need to be very sensitive, very, very compassionate, very sensitive to what they've gone through. It's easy when someone comes in the door to hustle them through a series of procedures and paperwork, and I've got to ask you these questions. It doesn't work with this population. You may need to really rethink the way that you're doing things, and rather than see them as just another number coming through the door, to take the time to be with them, to connect with them. You know, in our situation, even prior to having someone come in for our official intake, we've provided them with many hours of intensive case management, meeting them where they are, out in the community, and just connecting with them, because it takes a heck of a lot of trust for them. Even if the legal system is telling them to do it, it takes a lot of trust for them to come in the door and get the help that we think they need. So you may have to do a lot of legwork prior to actually getting them in the door.
Trust is essential in discovering the human trafficking piece of it. I don't think that in the entire year that I've worked with one particular client, she's ever identified herself as being a victim.
They may not see the things that they have gone through as having been problematic. Surprising to you or I to think that, but they may have think this was the only family I had. They were helping me, they were looking out for me.
The toughest part is, I think, the patience required, not just of the people working directly with human trafficking victims, but also the agencies providing the services. Patience, understanding, not expecting them to quickly get over it, because they're not going to, and there's a lot of things to unravel. There's a lot of work to be done around the trauma of it, let alone, you know, just reintegrating into the community.
The scariest part was that I thought he would never go to jail, and that I would still have to worry about people finding me and never knowing where to look or where to go or who to talk to.
Safety is a very big issue because, first of all, of the domestic violence component. So people who have been trafficked tend to have domestic violence in their relationships, and they can be very dangerous.
Yes, the therapy is important, but honestly, therapy may not be the most important thing starting out with. Getting someone off the street, getting some food in someone's belly, getting some benefits so that they can live a life, that's where it has to start.
The frustrating part is like really waiting, because it feels like you're never going to get the help that you need, and you're still going to be like on your own or homeless.
Well, what we try to put in place first is safety, and that would be housing. Not a shelter, because I think the shelters are too transient and fear-provoking. Having an apartment in town is something that is just a really good, it gives them a sense of independence that they've maybe never had before in their lives.
Most often, that provider or that initial responder is going to call local law enforcement, because they are usually the emergency responders. Then that information would then come to the FBI. In my territory, in reference to human trafficking, I would be involved and assist victims and their families. We have 5 victim specialists in the state of New Mexico. We have one in Santa Fe, one in Farmington, one in Gallup, one in Roswell, and then myself in Albuquerque. I do what I do because I believe that victims and their families deserve respect. I believe that people need help maneuvering the federal system. And so my role is to help with that. Help them understand what's going on in the federal government. There is federal laws out there that require that victims have rights. And so my job is to ensure that those rights are being met and responded to.
It's really important to know what statutes are in place, first of all, how to advocate properly with the clients, not just for them, but with them, so they understand how to advocate for themselves too.
We're only going to ask what we need to determine eligibility, and we want to get everything as quickly as possible so that we can get that assistance to them. We do have a special routing process so that it gets reviewed appropriate to their circumstances. The program application. Some of the benefits for U.S. domestic trafficking victims through the Income Support Division Office of New Mexico would be Supplemental Nutrition Assistance Program benefits, which is formerly the food stamp program. We have several cash assistance programs. Some of them are federally funded, commonly known as TANF, or Temporary Assistance for Needy Families. And we also have several cash assistance programs offered at the state level through state funding. Those would be for persons maybe who don't have children. We also offer over 40 Medicaid programs in the state of New Mexico. So we would basically direct you towards the services that best benefit you.
Carmela, whom within your agency should victim service providers contact to ensure that this process is done effectively?
So that we can ensure confidentiality and that the applications get routed according to each person's circumstance, it would be best if they ask for the county director. We have over 34 locations statewide in different counties and rural areas, such as Tierra Maria. During the application process, you will have a short interview. A caseworker will walk you through the entire process, asking certain questions, sometimes asking you to divulge sensitive information about yourself or maybe persons who live with you. Every person who applies for benefits with us has the right to confidentiality.
If a foreign national victim is certified as a human trafficking victim, and when I say certified, I mean it is a special process by a law enforcement officer who will sign an affidavit saying that the elements exist for human trafficking case. If that does exist, then the victim human trafficking is entitled to a special visa. Their first step is continued presence, which will allow them to remain in the country for a period of time while the case is pending if they're willing to cooperate. And the second step is the T visa, which will allow them to remain in the country for at least up to 2 years and lead them on the path to citizenship.
We have many services and Catholic Charities for human trafficking. I'm the sole point of contact for that to take care of those types of visas, the T visa it's called.
If the individual does not speak English, and if a service provider wants to assist a client or individual who is not English speaking, through the ISD office we do have interpreters available for interview.
The services that can be provided once a person is certified as a victim of human trafficking are the same as the one would have as a refugee. Now we have a refugee center here, so we're very well acquainted with the type of services that they would be entitled to as a refugee/victim of human trafficking. And that would include medical, housing, supplemental income support, and all that type of thing. And of course, most importantly, by getting the certification, you're entitled to work. So we have contacts with the business community to get them even its entry-level jobs.
The foreign nationals who are certified victims of human trafficking may be eligible for general assistance, which is a cash assistance program for individuals with disabilities. So we would need verification, medical records, a letter from a counselor indicating that there is some disability. That could include a certification that they have some post-traumatic stress disorder. If they are foreign national and they have the certification, there may be other programs that are available to them, such as the food stamp program, which is now called the Supplemental Nutrition Assistance Program, or if they had children, the Temporary Assistance Program for Needy Families.
One of the biggest challenges we face in establishing a good network to take care of our victims of human trafficking is the certification. Now, the official certification comes through the federal government, and that takes a period of time. And it could be as short as 6 weeks, or it could be as long as several months, depending on the situation.
What keeps me going every day is my faith, and knowing that I do have support around here, and that knowing that even though I'm having a hard time, I'm still making it. From here on, I just want to go to school, and I really want to be an advocate and help other girls know that they can get safe, they can get where they have to go.